Hi, my name is Joi Alexander, and I have the pleasure of serving as Director of the Wellness Empowerment Center at Georgia Tech. In addition, I also have the honor of serving as adjunct faculty for Southern New Hampshire in the Community Health Department since 2015. I am excited to tell you about my journey in public health, and I hope to inspire and empower you to choose public health, as there's so much that we can do together when your passion and commitment is in saving lives. I am excited to tell you about my journey that I have experienced within public health. My entire career has been in college health. I've worked at 3 different research Division I universities, all doing public health work and really trying to educate, advocate, and equip students to make healthy lifestyle choices, which has always been a passion of mine, to be able to pay it forward and to be able to work with college students, which are the future of our country, and the work that they will be doing to be able to empower each other is really important, because it's a pivotal time that college students have when they are entering college. And so being able to teach them with life skills that are really important for them to navigate not only their academic success, but also their personal success is what really makes me enjoy the work that I do and keep the commitment that I have to college students. I received a bachelor's degree in health education and promotion. And then I continued to pursue my master's within health promotion with a concentration in community health. And that's where I found my passion for college health, to be honest. I was able to teach a course that I fell in love with, that was a health course. And in that course, I learned that my population and my niche were college students. And I also learned the importance of health and that information, and how, for me, as someone who attended public school, the introduction to health was a very basic course. But in college, I learned a lot about the life skills that were not taught. And so that's what made me pursue college students as my area of interest. So when I was pursuing teaching, when I was in graduate school, is when I found my niche for college students. And that's when I chose to stay with that population and chose to be able to identify what was available for me to stay with college students and be able to educate them on the importance of life skills. And that's when I was introduced to health education. Being a health educator was very much a career that I had not known about prior to attending college and being able to learn about the different aspects of public health. Oftentimes when people think about public health, they think about community health, they think about school health, they think about the CDC, they think about health departments, and all of them do amazing work. Yet, often people don't think about college health. And so being able to learn about the importance of health education in a college setting was really important for me, because I was a generalist. And so as a generalist, you have to kind of know a little about a lot. And I would say that that opportunity really exposed me to working on the ground and being able to really build relationships with college students and be able to learn what were their stressors and how was I able to really support them to ensure that they were not alone and that they were able to feel supported and that they were able to have the skills that they needed to be successful during their time in college, but also when they graduate. And so that's where my career started within health education. And I feel that it will always hold a special place in my heart, because that was the first time that I was able to really be on the ground and be able to really hear students and listen to students and be able to advocate for them. As my career ascended, I was able to also, I knew that I had some leadership skills that were inside of me, that being a health educator, even though I loved it and I was able to be with students, that I was not able to make the changes that I needed to make within systems and policies and infrastructures at an institution. And so I chose to leave the institution that I was at, and I chose to go to another institution, and I became the assistant director of the wellness center there. And so in that role, I was overseeing alcohol and other drug prevention and wellness initiatives. And so within that was really important work for me, because oftentimes college students experience or experiment with alcohol and other drugs at a very high level in college. And so being able to really educate them on the importance of how can we really promote harm reduction? What are some ways that we can allow you to understand the importance of a standard drink? And what are some ways that if you choose to drink, that you can take care of yourself and others? And so the institution that I was working at was very much known for sports. And oftentimes with sporting events, alcohol is a part of that event as a celebration. And so being able to take that on was something that was really important to me, while also infusing wellness as a lifestyle choice was something that I really enjoyed. I did that for some time, and then I said that I wanted to do something and be able to be at the table when decisions are being made. And so that's when I chose to leave that institution and come to Georgia Tech. And so that coming to Georgia Tech was fun and exciting, but also extremely challenging, because this was my first STEM institution, a science, technology, engineering, and math. And so the other institutions that I have worked for, they had public health programs, they had majors, they had students that I could engage with within the work to be able to really push it forward. And so working at a STEM institution is a little different, because these students are very committed to their degrees and their majors, yet they sometimes don't connect the importance of health and wellness into their career, because it's not taught in the classroom. And so my challenge became, how do I infuse health and wellness into the infrastructure of Georgia Tech, where the rigor has made this institution not always focus on health and wellness, but being successful in the classroom. And so my challenge was different. I came from two institutions that were based on sports and very much, adamant on being able to be successful in that area, to coming to an institution that could care less about sports and cared more about the classroom experience and being successful in the classroom. And often that meant that they were depriving themselves of sleeping, of eating, and being able to really take care of themselves and neglect themselves as a pursuit of their academics. And so with that, my work really consists of leading a team of 12 professional staff that all have different specialty areas that they focus on, from nutrition and body image to sexual violence to being able to talk about sexual health and stress and time management and resilience and sleep and all of the skills that often aren't taught in the classroom. And so for me, my role as the director, I'm the visionary. I'm the one that has to look at the big picture. I'm the one that has to build relationships with faculty to be able for them to understand the purpose and existence of my department, but also how we can support their students. And so being able to do that is something that I really enjoy, because I'm able to use all of the skills that I learned from a health educator to an assistant director to now being a director to make sure that the department runs successfully. So a typical day for me, it really depends on the day, I'll be honest. Depending on the semester, it really depends on what I am engaging in. And so oftentimes in the fall semester, that's typically in August when classes start back up for students, I am doing a lot of meet and greet and being able to meet with faculty, meet with staff, meet with students, meet with student organizations, And I am very much in the trenches of being able to get to them and get to allow them to learn about my department and how we can support them before crisis or intervention is needed. And so the first 90 days is typically considered the red zone, if you don't know, within colleges. And so the reason why it's called a red zone is because typically that's when high risk behaviors are occurring. And so for me, my typical day is being able to make sure that I am able to learn students, learn about what their needs are, but also get in front of them so that I can inform them of my department and how we can best support them. And so with that, I will say, as a director and being a visionary, you also have to have good relationship skills, because for my work to push forward, I have to ensure that I have built relationships with people. And oftentimes people don't care what you have until they know that you care about them as a person. And so being able to really use those people skills and those relationship building skills is the way that I can push the work forward for my team to be successful in implementing, evaluating, and executing successful programs and initiatives for students. And that looks different. And so I think for me, being able to know what I have to offer students is really important, but also within my department, our mission and our vision is making sure that we are using evidence-based strategies and that we are educating, advocating, and equipping students with those skills to be successful in and out of the classroom. And so a typical day for me typically looks like a lot of meetings, a lot of meet and greets, but also being able to follow up and ensure that whatever I committed to, that I'm delivering within that, not only with my team, but also with my stakeholders. The advice that I have for anyone that's interested in public health is to think about college health, right? Think about a different trajectory and being able to make an impact in a population that you can resonate with, right? You were a college student at one point in time. And so being able to work with college students is very rewarding, but I'll be honest, a lot of students don't think about that. And so think about health education and think about the ability to be on the ground with college students and be able to pour into them what you learned during your time at Southern New Hampshire. And so I think that's really important for students to think about the ability to follow your trajectory and focus your efforts with a specific population that is in need and does have specific stressors that your skills and your abilities can help support them. In addition, I would always say continue to be a learner. You know, when you graduate, oftentimes you jump into the field and there's things that are evolving and changing in the field. And so make sure that you keep your learning hat on and always be open to different adventures so that you can stay up to date. I can say, working with Generation Zs, I have had to continuously learn because of the fact that the way that we are taught and the way that it's delivered sometimes doesn't always resonate. And so make sure that you are flexible, make sure that you're adaptable. Sometimes how you start your career is not how you will end it. And so know that whatever it is that you choose, that there is an opportunity for you to learn. So be a sponge and really grasp all of the information that you can while you're in that position so that you can take that information to the next position as you continue to climb the ladder wherever you are, because sky is the limit for public health. And I am an advocate that if you are interested, there is something for you to do to support the community.